Hello, these are Flip Notes 5.2, and in this section, we're talking about explaining and classifying psychological disorders. So previously, we looked at health and positive psychology, and those are ways to support your mental health, but when things don't go well and you're not able to do that, it can lead into psychological disorders. So that's where we are now. So what are psychological disorders? How do we identify what a disorder is? Mental disorders are characterized by abnormal thoughts, feelings, and behaviors. They can be distressing. They can affect people's personal lives, their social life, their occupational life. So we usually identify 3 Ds. To identify a disorder? We ask if it is dysfunctional, is it distressing, and is it deviant? Does it deviate from social norms? We'll go into each of these. So when behavior is dysfunctional, and sometimes the word that we use is maladaptive, we're referring to how much it interferes with their everyday life. Is it interfering with their thoughts and their feelings? But how much is it interrupting their daily activities? Is it keeping them from holding down a job, from going to school, their social interactions, and taking care of themselves? So for example, maybe a person feels depressed, but they're still able to function. They can get out of bed every day, they can care for their children, they can take care of their hygiene. But when they stop being able to do those things, then it might be considered dysfunctional and maybe qualify as a disorder. So that dysfunction is one of the real key diagnostic factors is, again, can they function in daily life? Because if they cannot, then it may qualify as a disorder. The next category, is the behavior distressing? And this one is more just a personal level, because what may be considered a high level of anxiety and stress or sadness to one person may not to another person. So it's what they perceive as emotional or psychological pain. And it's also what a person is able to cope with before they actually seek help when their stress becomes unbearable. So sometimes distress can manifest as intense emotional suffering, like they may feel senses of worthlessness or panic that they can no longer cope. Often once they get to that level where it's distressing, it motivates individuals to seek the relief and treatment, and that's where their mental health journey may begin. The next one, again, is deviant. Does the behavior deviate, or is it different from what society considers normal behavior? So behaviors, thoughts, or feelings that significantly different what's considered acceptable. And this one can be pretty subjective, especially between cultures. But when they get too far from what culture accepts as normal, then it can indicate a potential disorder. So for example, hearing voices in a religious setting, hearing and saying that God talks to you, hearing yourself, like have your inner voice tell you to do something, that's considered a spiritual experience and maybe considered normal. However, a person who is standing on a street corner naked and saying God is talking to them and telling them to do things, that can be symptoms of a psychotic breakdown. So it kind of just depends on the situation. And then a fourth one, which is not always categorized as one of the criteria, but it does fit in here, is the question of danger. Because especially when it comes to should a person be hospitalized, that is a factor that's included. Is the person at risk of danger to oneself or others? So I do want to take a moment here to talk about that the vast majority of people with a mental illness are not dangerous to the public. If anything, they're more dangerous to themselves. They're also more likely to be victims of violence than people who actually perpetrate the violence. So there's studies that show that often the people who have mental illness, they have things like anxiety and depression, and they're more likely to hurt themselves than anybody else. Factors that can increase that risk of violence of people who do have a mental illness is if their mental illness goes untreated, if we're factoring in substance abuse, if they've had a history of violence, and if they lack that social support. So So it's important to know that mental illness is not a predictor of violence, but it's often portrayed that way, that the media and movies often show, serial killers who've had a mental illness, but those are actually really few and far between. And again, they contribute to that stigma and discrimination that actually keeps people from seeking help. So when it comes to diagnosing a psychological disorder, the way it's done is through a systematic assessment of symptoms. We look at things like duration, how long the person has been feeling that way, the intensity level, and that's one of the things that has kind of changed over time with diagnostic criteria, is instead of identifying subtypes, that we identify like on a spectrum, what level of behavior they're feeling or experiencing and how it impacts their functioning. So usually it involves clinical interviews. So sitting down and talking to a person. A lot of diagnostics or diagnosing starts with a person's general physician and just talking to them there. It may lead to psychological testing, but also considering medical history, because a lot of times a medical condition can be a factor leading to a psychological disorder. Having a diagnosis can have consequences, both positive and negative. The positive is that the disorder can be identified and can help the person, but it's important to recognize that there's a separation between the disorder and the individual. A person is not just their diagnosis. The negative is that having a diagnosis can lead to stigma, that a person who's diagnosed as having anxiety or depression, that now people think less of them, that maybe they're not capable of doing what they could before they were known to have a diagnosis, which is not true. So cultural and societal norms have really started to change on this, but they're not completely gone. Having a diagnosis can lead to racism and sexism and ageism and discrimination. So similar to all of those types of discrimination, having a diagnosis can lead to the same behaviors. When it comes to diagnosing, for people, physicians and therapists to do that, they have different types of training and tools. So specialized training in how to identify and distinguish between disorders. We know that psychology today is based on empirical evidence, so evidence-based practices. There have been classification systems that have been created within the medical and psychological fields, and they're constantly being updated. Two major sources that are used when it comes to diagnosing disorders. The biggest one is the DSM, or the Diagnostic and Statistical Manual of Mental Disorders. It's been revised multiple times, so we're currently on the DSM-5. And then another text, the International Classification of Diseases. We'll talk about each of those a little bit more. So the DSM came out in 1952, and it was published by the APA, the American Psychiatric Association, and it has been updated many times over the years. And like I said, we've made it to the DSM-5. The main reason was that we needed a standardized way to diagnose mental disorders. So the way that a doctor in California diagnoses somebody, maybe they identify a behavior as bipolar, that somebody else is not just calling that OCD. So by having a list of symptoms and descriptions of characteristic behaviors, that makes it easier to have a more standardized way to identify disorders. So it's widely used throughout the US and internationally. It creates a common language, and that language has been changed quite a bit over the years. So for example, we used to call the disorder where somebody thinks that they have a physical illness all the time, a hypochondriac or hypochondriasis, and now that's called illness anxiety disorder. Other ones like Asperger's is now identified as autism spectrum disorder. So some of them have changed names over the years as we understand more about the disorders. But having the DSM helps us to improve consistency and reliability. And again, it's constantly being updated as we learn more about different disorders. The other text, the International Classification of Diseases, or the ICD, is more of a global or international resource that's developed by the World Health Organization. Probably the biggest difference is that this is not just for mental psychological disorders. It's an actual physical medicine. It has lots of medical things in there too, and it just has a section on psychological disorders. So, how do the different psychological perspectives explain different disorders? So, we're kind of flashing back a little bit to those perspectives that we talked about at the beginning of the year. We've talked about this a little bit, the term an eclectic approach. An eclectic approach means that there are multiple perspectives, the idea that there are lots of different ways we can explain a behavior. So, for example, if we're talking about depression, we could use every one of these approaches to explain why a person might be depressed. So the eclectic approach says that instead of just sticking to one school of thought, that there are multiple ways that we can explain a behavior. So an eclectic therapist integrates methods from all kinds of different approaches. They might use cognitive behavioral therapy, but also look at psychodynamic therapy, which would consider behaviors that are influenced by experiences from the past. But they also may incorporate humanistic therapy and even tailor and tie in biological treatments through medication, but all to the unique circumstances of each client. So the behavioral perspective says that a psychological disorder is the result of classical conditioning, operant conditioning, or that they have learned it through observation, that somehow there was a maladaptive way that they learned something. Maladaptive means not a useful or functional way. And they have formed associations between things that are not good. So maybe when they were little, they got bit by a dog, and now they're scared of all dogs. So that could be an example of this classical conditioning. Another example, a person with a phobia of spiders might have developed this fear through classical conditioning or a traumatic experience. So then behavioral therapy is going to try to extinguish that, for example, systematic desensitization by gradually exposing them to spiders in a controlled and safe environment. But the behavioral perspective primarily says that the behavior was learned through conditioning or observational learning. The psychodynamic perspective, which is based off of Freudian views, but this is a more modern version of it, says that there are unconscious and childhood conflicts that are affecting their behavior today. So it doesn't really reflect so much the idea that Freud had of things like the id, the ego, and the superego, or the idea of a deep level of unconsciousness where we have sexual urges and tensions and things like that. But rather it focuses on childhood and experiences that happened that you may not really recall, but they did happen to you when you were younger and they're influencing you now. So for example, a person with depression might have unresolved grief and internal conflicts from their childhood, and they want to bring those to their consciousness to try to resolve them now. The humanistic perspective takes a more positive look at helping people by supporting them to reach their full potential. It believes in showing unconditional positive regard. So no matter what a person says, the therapist is going to show them support and find good in what they're telling them, and help them to reach a level of self-actualization. A lot of times this perspective says that a reason a person is struggling is that they're lacking social support, and that is keeping them from fulfilling their own potential. So showing them that support through the unconditional positive regard can help them with what they're struggling with. So a person who has low self-esteem and anxiety, they can benefit by hearing the therapist offer that unconditional positive support, that somebody is there for them, showing empathy and understanding to help them realize their potential and to develop a more positive self-concept. The cognitive perspective says that disorders are the result of maladaptive thoughts. So thinking negatively about themselves, having negative attitudes, negative emotions, but overall how they perceive themselves is maladaptive. So maybe they're overgeneralizing. Like I had a bad experience with one person at work, and now nobody at work is going to like me. And then convincing themselves that I'm not going to be able to work anywhere or I'm worthless because of this one bad experience. A person with generalized anxiety disorder might learn to identify these irrational thoughts and then learn, okay, that was just one bad experience. I can overcome that. That's not all my experiences. And then learn these different coping mechanisms. The evolutionary perspective says that the reason that we have disorders and these maladaptive behaviors is because they were things that we needed for survival a long time ago, but they don't match the modern world. So they were advantageous, but now they don't match contemporary living conditions. So for example, a social anxiety disorder can be seen as an exaggerated form of social vigilance. So you needed to connect with others in order to be safe, but you were highly vigilant because you had to be cautious of what was dangerous or not. So now the modern version of that is that you're overly worried about others. The sociocultural perspective says that problems with relationships and cultural expectations, dealing with social norms are what leads to disorders. So, for example, eating disorders like anorexia are influenced by a person believing that they have to match society's ideals. Pressures from family and friends and the media, all of those expectations can lead to disorders, according to this perspective. The biological perspective says that disorders are the result of brain abnormalities, genetic influences, brain chemistry, and a chemical imbalance when it comes to neurotransmitters and hormones. And it says that there are physiological explanations for their behavior. So they are medical conditions that can be treated with pharmacological, so medication, and other medical interventions. So for example, schizophrenia can be treated with antipsychotic medications that target dopamine pathways, and that'll help reduce hallucinations. Other things like depression can be treated with SSRIs, selective serotonin reuptake inhibitors, to increase serotonin levels. Often the biological perspective, though, is usually paired with one of the other perspectives because it's often not just a chemical imbalance, but it's a chemical imbalance paired with a cognitive explanation. The interaction models say, like the eclectic approach, that there are multiple explanations combined. So the biopsychosocial model says biological factors, psychological factors, and sociological factors contribute to disorders. So in the biological section, that can be a genetic predisposition that depression and anxiety may run in a person's family. Neurochemical imbalances, that their brain, for one reason or another, is overly sensitive to dopamine, and that makes them more prone to a gambling disorder. And then other physiological influences, but that could also include things like a brain tumor that influences behavior. Psychological factors, those are things like cognitive patterns, again, like false and maladaptive thinking, a personality trait that may be more prone to worry or jealousy, poor coping mechanisms. Those are all psychological factors. And then social factors would be the environmental influences like family dynamics, pressure from family, having or lacking social support, trying to match cultural norms. A big one, socioeconomic status, which can affect one's ability to get support, and just other life events like grief and job loss that can affect a person's mental health. Finally, the diathesis stress model says that one affects the other, that genetics and environment do play a role. So a person may have an underlying predisposition for something, like they may have the genes for schizophrenia, or they may have a genetic predisposition towards depression. However, if they don't face the environmental stressors, like difficult life circumstances, then they may never actually trigger the onset of the disorder. So this is especially true with schizophrenia, where it's been found that people may have the genetics for this disorder, but if they don't have the chronic stress, they don't have the negative childhood experiences, they don't experience trauma, then they're less likely to actually see symptoms of schizophrenia. All right, we will get into more details about each of the specific disorders, but for right now, that's it for 5.2.